One of the more common surgeries in women, particularly women in their 40s, is hysterectomy. There are about 600,000 hysterectomies a year in the United States. That's a lot of hysterectomies. We're working aggressively to discover and determine if there are non-surgical approaches to the management of fibroids, abnormal bleeding, and other common causes that lead to hysterectomy. We've been very fortunate, and I think we're going to have, within the next year, a medical treatment for the bleeding from fibroids that can be used for long periods of time, recognizing that when a woman goes through menopause, her need for additional treatment for her fibroids is usually gone or at least minimized. The idea of preventing a substantial portion of those 600,000 hysterectomies and the surgery and hospitalization and complications that are inherent is very exciting. One of the things that we do is consult with women who have been recommended hysterectomy to determine whether it's really necessary. Sometimes we can offer medical treatments. Sometimes we just reaffirm the fact that she needs that surgery so that she can either get pregnant or have that bleeding or pain or pressure stopped. Fibroids, so-called, sometimes called leiomyomata uteri, oh my goodness, fibroids are a very common benign tumor. I didn't say cancer, I said tumor of the uterus. Very common. What do I mean by that? 50% of African American women have fibroids. About 35% of Caucasian women have fibroids. Slightly less than that, Hispanic women. The only women that are really spared are the Asian women. They seem to have a much lower risk. But anyway, very, very common, leading the reasons for hysterectomy. Number one reason for hysterectomy, fibroid tumors leading to bleeding, pressure, or pain. And in fact, we believe many of those women with symptomatic fibroid tumors can actually be spared hysterectomy with the proper medical treatments. Now, fibroids can also cause pain, pressure, frequency of urination, the feeling of needing to have a bowel movement all the time. I can't imagine. But with proper medical treatment, they can be diminished in size and those symptoms alleviated even without surgery. We're specialists in taking care of women after hysterectomy. Not infrequently, a woman's ovaries will be removed or damaged with a hysterectomy. Even in the best of surgical hands, it's now known that about 25% of the time, with a simple hysterectomy, even when the ovaries are left in place, one of those ovaries will fail with extreme hormonal consequences. For that reason, a woman needs to be very careful after a hysterectomy that her hormones remain normal for all the reasons that women need their hormones. She may think that her ovaries were left in, and they may have been, but they may not be functioning normally after her hysterectomy. The reason for this is relatively straightforward. While the normal blood supply to the ovaries has very little to do to the uterus, in a high percentage of women, the blood supply to the ovaries comes from the uterus. And if the blood supply to the uterus is removed when the uterus is removed, so also the blood supply to the ovary is limited or decreased or removed. In those settings, women have hot flashes sometimes, or minimal symptoms sometimes, but will benefit from proper hormone replacement so that she has the hormones that she had before she went to surgery after her surgery.